Hello, good morning, good afternoon, or good evening, especially to Mr. Shashi. And this vlog is intended for one of the Antiparkinson drugs, and I will do its counseling, a bit about its counseling, and mostly about the patient medicine information. Okay, so the drugs that I have choose is the Entacapone, ECONT inhibitor Antiparkinson's. So why do the patient needs the medication is it is used together with other medicine to treat Parkinson disease. So this Parkinson disease is disorder that affect movement of a person. They causing symptoms such as tremors, muscle stiffness, slow movement, and impaired balance or walking. So it is used to improve the medicinal effect of another Parkinson disease medicine called levodopa. So this entacapone cannot cure Parkinson disease, but it can improve the quality of life for people who have the disease. So how do the patient need to take these medicines? So the entacapone should be directed by the doctor according to the instruction on the label, which is do not take more or less than instructed by the doctor. And then they take the entacapone together with each dose of levodopa. So this entacapone can be taken with or without food, and usually the pharmacist or the doctors or the consultant will suggest to take this entacapone at the same time each day so that the patient will not forget. So the entacapone must be taken regularly for it to be effective, and continue taking the entacapone even when the patient feel better, and do not stop taking it unless instructed otherwise, as stopping it suddenly can worsen the patient condition. So what if the patient forgotten to take these medicines? So the patient should take the missed dose as soon as the patient remember. If it's almost time for the next dose, skip the missed dose, not return to dose, and return to the normal schedule. And in under any circumstances, do not double the dose. And if you often forget the medication, let the pharmacist and the doctor know so that they can have any further suggestion for you. So when should I or you not use these medicines? So alert the doctor if you have a few conditions like liver disease, adrenal gland tumor called pheochromocytoma, history of neuroleptic malignant syndromes, history of non-traumatic rhabdomyolysis, because this entacapone may be not suitable for the patient that have this type of condition, and it might be contraindicated. And then this entacapone cannot be concomitant with antidepressants such as isocarbosexate, phenolzine, and trenylsilpromide. So what should patient take note while taking this medicine is inform the doctor if you have any bile duct obstructions, any kidney disease, any heart disease, and any tardive dyskinesia. So other than that, you should tell the doctor if you are pregnant or breastfeeding. Okay, side effects that the patient might experience from the entacapone are confusion, hallucination, unusual changes in mood or behavior, uncontrolled movements such as twitching or jerking. And other than that, entacapone may also turn your urine to orange brown color, which is this is quite harmless, and the patient should not be alarmed. However, the patient should inform the doctors. So, can you take the Entacapone with other medicines? So, usually the pharmacy will suggest that do not take Entacapone with medicine used to treat depression, as I said before, like isocarboxetine, phenelzine, and triazine bromide. And the patient should inform the doctor or the pharmacist if he or she taking medicine for the heart or blood pressure, such as adrenaline and methyl-dopa, or any blood thinning medicine like warfarin and iron pills. Because if you are taking iron pills, you should not take the iron pills together with Entacapone, because there should be at least 2 to 3 hours before or after you have taken the Entacapone. Then you can take the iron pills. So is there any special dietary instruction that the patient should follow? Is one is to avoid the alcohol, and then the storage of this medicine is it should be stored in cool, dry away from the reach of children, and medicine must not be used past the expiry date. So I think that's all for me. So yeah, thank you for listening.